So, hello friends, good evening. My name is Shrenik from Ahmedabad, and I'm humbled to mention I'm a global auditor, three times direct speaker, and I'm having incredible privilege and honor of being a patient ambassador and moderator of Indian Cancer Society Delhi branch. Fortunately, today is my first show with the title as Fridays with Shrenik, and I am super excited to welcome my dear friend and acquaintance for more than 15 years, Dr. Daxesh Patel. Is a cancer surgeon from SAG Artha Cancer Care, having 18 years of experience as a cancer surgeon and got trained at MSKCC and many other global cancer hospitals. And apart from being a cancer surgeon, is absolutely down to earth, thorough gentleman, and always wearing a smile and ready to help patients and caregivers 24 by 7. Sir, you are more than welcome, and I would like to add for all attendees before Dr. Daxesh sir taking over. Today's topic is very important. You just take into consideration you have to speak naturally, and by any chance you have lost voice, what would be the life without spoken words? It is causing catastrophic situation. I mean, sheer helplessness, frustration, and whatnot. And that is the life I am living for the past 27 years. And there are too many individuals all over the world who are facing same challenges like me. So today we have invited Dr. Daxesh Patel to address this very important uh, problem and how to address the loss of natural voice into opportunities and making things happen throughout the life. Sir, uh, welcome once again, and the stage is all yours.
Thank you very much, Shrenik Bhai. It's my great privilege to be with Indian Cancer Society. Thank you very much, Indian Cancer Society, for having me. And again, privileged to share a platform with a TEDx speaker. I have never been before with any of the TEDx speaker on the same platform. So it is indeed a great moment of pride for me. And before starting my topic, I would like to say, of course, about Mr. Shrenik Bhai that he is an amazing person. I have never seen such a motivated person who has fought with the cancer long time back, but now helping many other patients to carry on for the treatment because cancer of the vocal cord, cancer of the larynx is indeed a dreadful disease, and to come out of it needs a lot of mental challenge and mental stability. And Shrenik Bhai has done it very well a long time back, and now he's helping many other people, not just for the vocal cord cancer, but any type of cancer in the body. He is our brand ambassador. Whenever I have a in my personal practice also, whenever I have a problem in convincing patient about vocal cord cancer, I just show. Initially, I used to call Shrenik Bhai. He used to come to explain, to counsel the patient, but now I show them the videos, like how he is roaming around the world and encouraging patient to go to undergo treatment. So thank you very much, Shrenik Bhai, for this wonderful, noble work that you are doing, and hopefully you will be doing for many years, and motivating patients and the persons and their families also. Thank you very much.
Thank you, sir.
So today, as he said, I am a head and neck cancer surgeon. I specifically deal with cancers related to head and neck. And today we are going to talk about the cancer of the vocal cord, the larynx. The larynx is the voice box, which we commonly call as, and it helps us in speaking. Now, speech, as we all know, is the very important part for any developed civilization. uh, as he said, imagine if you can't speak and you want to convey something. So that is, with the sign language, it comes, there is so much of frustration it comes when you want to say something but are not able to say it. So this is one of the dreadful disease to have, but fortunately we have many ways to cure it, and we'll go in detail one by one. So first is, what is vocal cord cancer? Vocal cord is the thing in the voice box is a big structure. It is about 5 to 6 centimeter structure in the front part of your neck, and you can visualize when you swallow, the things which goes up and down is the voice box, and from where the speech comes. And then with that voice, with that sound, you give the syllables with the lips and the tongue. So when there is a cancerous growth which occurs in the vocal cord, so the first thing which a person notices is a change in voice. So that is the first presenting complaint with the patient comes to our clinic. So that is, and we do the set of investigation later on and then establish the diagnosis. But primarily, it is the cancerous part. There is some tumor at the vocal cord which is causing this problem. So many people, they ask what was the causes, like when we talk about the cheek cancer, tongue cancer, jaw. So what causes the cancer of the voice box? So that is, I don't think anybody in the world, educated person, needs to make them aware that what causes. Everybody knows, and that is the smoking, right? Smoking is the first the most important cause for developing this cancer. It affects 95% of the patient, the cancer of the voice box. If you ask them, 95% of persons will say that I smoked sometime in my life. There are few other cases, like the remaining 5% of cases, where smoking is not the present the history. The person never smoked in their lifetime, never chewed tobacco in any of the form, but still he developed cancer. So in those 5%, we are not yet sure what causes them, but primarily, majority of the patient, the smoking is uh, the main cause for developing cancer of the vocal cord. And how do you know then? How a person will know that I have a cancer? So first, he will feel some change in voice. The voice will become hoarse. Patient has to put a lot of effort in speaking. So this is little different from what we usually have in a seasonal flu kind of symptoms, where your throat goes down, or when you speak at a loud voice for a few minutes or hours, and then your voice goes down. This is different from that. Usually the infection in the throat, or because of the exertion, if you have a voice problem, that will be like you feel okay in couple of days, like 4 or 5 days, or maybe maximum a week. But if the cancer is developing, your voice change will persist for more than 7 to 10 days, and that is the time when you need to be alert and you need to seek help from your medical professionals. So what they do, like if a person comes with me with a problem of a change in voice, we usually have a small camera in the scope which we put in the mouth, and we can see the larynx. So this is how we visually see the vocal cord and try to find out if there is any problem in the vocal cord. If we see a cancerous growth, a tumor kind of thing, then we take a biopsy, process it, and then make a diagnosis of cancer. So this is usually one thing which is very common. How do we make a diagnosis of cancer? But important thing for a general public, for a persons, is if you have a complaint of voice change for which is persisting for like more than 10 days, 2 weeks time, you definitely need to consult a doctor who can see inside your throat and say whatever is going on inside, right? Um, Once we make the diagnosis of cancer, what next? So there are treatment for that, surgical treatment. So in we have a basic three modalities by which we deal with the cancer in the Western medicine. That is, we have a surgical treatment, we have a radiation treatment, and we have a chemotherapy. The chemotherapy really doesn't work as a definitive treatment in these cases, but in early cancers like stage 1 and 2, uh, we can use either radiation or surgery as a modality of treatment. Both the modalities have an equal cure rate. Surgically, we remove small portion of that cancerous part from the vocal cord, and this is in the early cancer, of course, stage 1 or 2, where we remove small part of the we strip off that cancerous part from the body, and patient is cured. And in radiation, the radiation, we have a big radiation machine where the radiation portals are radiation is being given from either side of the neck, and it kills the cancerous part and cures it. So these are the two basic modality in early part of cancer. Both have a equal cure rate. Either of it can be utilized. It has to be discussed with the patient about the preferential method. Doctor also have a something to say about which modality is better for them, considering the patient's factor, how big is the tumor, what are the patient's preferences, what are the patient have any other coexisting problems, medical problems or not. So combining all those things, doctor usually takes a decision about which modality will be better for the patient, either surgery or radiation. Uh, yes, so and the main thing which people are scared of is about the stage 3 or 4 cancer, which Mr. Shrenik Bhai is gone through, right? So in those uh, stage 3 or 4, specifically stage 4 cancer, the treatment is little extensive in the form of removal of the voice box. Now, suppose, see, we have a voice box over here and we remove it. So what does voice box has a functions? These are two tubes. The one tube is for the wind and one tube is for the food. So once we take out the voice box, the wind pipe will be open here. So when we breathe from the lungs and exhale, like in a normal person, I can exhale from the mouth or nose. But when we do surgery at the voice box, the patient will have a permanent hole here, and it is the hole from which they will be breathing for lifetime. So the normal speaking mechanism is gone. The entire structure is gone. Uh, Patient can eat by mouth normally. That food pipe is normal. We preserve that. But because of the higher stage, the tumor is bad. We need to take out the whole voice box. That is a time where we have to put the hole here, and patient breathes for the lifetime from that hole. So this is the surgery which is usually people, the patients are very fearful that they don't want to go, they are not convinced initially. We have to make them convinced that this is the proper treatment. So for this, I remember one of my professor used to say that this is not the bad surgery. When we explain the patient about this surgery, they feel horrified. They usually start crying that what am I going to like undergo this kind of treatment. But one of my professor I said used to say that this is not the, the bad surgery. It is the appropriate surgery for the bad disease, and you can get cure with this appropriate disease. The only downside is we need to take out the larynx, the voice box, and so once that is out and once the surgical field is healed, then the important thing which comes is the how do we speak, how do patients speak back again, because Imagine if you can't speak, how are you going to convey? You can't write uh, for every sentences you want to convey. You can't speak longer time. So that was a challenge initially, but the scientists have made a great contribution in the past. We have two very popular method of speaking. The one uh, is called the electrolarynx, which Mr. Shrenik is utilizing that method. So basically, it is a this small, around 5 to 6 centimeter cylindrical. It's called electrolarynx, which has a vibrating capacity. It vibrates. There is a machinery inside which runs on a battery. It vibrates and produces a sound. That person has to keep it near below the jaw line and start the machine. It will produce a vibration, the noise, and then with the help of the lip and the tongue, you convert into uh, the words, right? So basically, whatever vibrating system was normal, the God given, the voice box, that has been taken out, but you have another vibratory noise making system from outside, which you have to place it, and then with that vibration, the noise is coming, and with the lips, with the help of the lip and the tongue, you convert that noise into a proper speech. So you have heard Mr. Shrenik by using those that technique for last, I don't know how many, 20 years, more than 20 years now. So that is the one thing which is very easy,
Sir,
very handy.
20, 27 years. 27
27.
years.
Oh, I'm sorry, it was a very long time, 27 years. So that is the one which is the method which is very easy to adapt. You don't have any other thing. You should just have that the instrument with you and properly charged batteries with you, and you are good to go anywhere in the world, and you can communicate with anybody with this voice. There is another method which is inserting a small valve into the throat between your food pipe and windpipe, which is called tracheoesophageal prosthesis. So that is the thing which again uh, functions on the air, and person has to close the opening which we have created. Inhale, close the opening, and while exhaling, the air will go through that valve. It will vibrate. It will make some noise, and again you, with the help of tongue and the lips, you convert that noise into the words, and thereby you can speak. So this is another method, but that needs a little surgical procedure to put that valve into your throat. It needs a proper care of that also, and you need to change it after a frequent interval, because it's made up of silicon, but with the wear and tear effect, it needs to change after a few months or maybe a couple of years. So that is another. This is another method of speaking once you uh, undergo total laryngectomy, which is the removal of the voice box. Third method, which is not very popular, not very easy, is called the esophageal speech, where you gulp the air inside your throat, and when you gulp the air, you need to take it out, like in burping. And while doing so, the noise will come, and you convert that noise with the help of tongue and lips. You again convert into the words, but that is not very popular method of speaking. Like, it needs a lot of practice also, and maybe out of it, laryngectomy patients, hardly two or three, or maybe less than that, will be able to master this technique and speak. So primarily, this is the electrolarynx and the tracheoesophageal prosthesis are the two widely used method for the speaking. That is, I guess, any questions till now anyone to ask? I guess I have given a brief overview about what the cancer vocal cord and how do we treat and how do we rehabilitate them.
I
Yes.
have a question.
Yes,
Can I ask a question?
yes, please go on. Please proceed.
You see, what happens is that when the radiation is given, we usually say that you can get, thyroid cancer. Now, especially this is the portion where you're going to operate. So the risk of getting a thyroid cancer is more when you are giving radiation here. So
No, with
after
the
the operation, as you say.
so once the surgery is done, we usually preserve the thyroid if it is not involved by the cancer of the voice box. But by giving radiation, thyroid will not develop cancer.
Beg your pardon?
When you give radiation to the voice box,
Yeah.
the thyroid cancer will not occur. That is very, very, very rare phenomenon. It doesn't occur that commonly. That occurs when the radiation is being given to the children like below 10 years. Those when they are exposed to a high dosage of radiation, those kids will get cancer. So if you might have heard about the Chernobyl accident or the Hiroshima Nagasaki accidents, those where the radiation amount is high in the environment, then and when they are exposed to the kids, those kids in later age will get cancer of the thyroid. Because of radiation, you will not get cancer of thyroid.
No, because
Did you
you
get my
see,
point?
why I'm asking this question is that when we go to a dentist, they always that you wear a sort of guard because that
Yes.
anything that, when you take a picture of your teeth or something, the radiation
Got,
should not
got your
go to
point.
the
Yes, I
thyroid.
got your
So
point.
that is why I've asked this
Yes.
question that if the radiation is given over here, is there a risk of cancer happening in thyroid?
Yes. So when you give radiation to the voice box to treat it, those things are different. For dental X-ray, or even if see, you might have seen that while taking an X-ray of your chest or leg or whatever, the X-ray technician will go behind the shield because that is his daily job. If he is exposed to this kind of radiation daily, he might get cancer. But for the radiation given to the voice box, you will not get thyroid. You will not get thyroid cancer. But of course, you need to protect yourself, important organs, while taking X-rays of the other organs. Like if I'm taking dental X-ray, of course I will have the shield for thyroid, right?
Thank you.
Uh, so,
Yes,
fortunately, I am among the rest of 5%. As you explained, I'm into rest of 5%. I have never smoked. I have never consumed tobacco, non-alcoholic, strict vegetarian, and perhaps that is the only reason that I'm celebrating 28th year of my survivorship. That was stage 4. So it's all about avoiding smoking or using tobacco in a different formats. So I fully agree with you. Now, sir, I have one question. You very well explained, and let me add one thing. While the madam asked about thyroid cancer, in my case, when the surgery was performed, part of the thyroid is already removed for precaution, and I am on a enterogen for the lifetime just to balance the thyroid function. So just no add to that one. Now, sir, I have very important question. When what is the ideal condition of suggesting the radiotherapy as against surgery of a vocal cord, because normally while advising radiotherapy, you can preserve the voice, right? But I have noticed that few years down the line, maybe 2 years, 5 years or so, usually the cancer is recurring. So, what is the ideal approach when a Shrenik patient is approaching you?
Right. So basically the treatment modality depends largely on the stage of the disease. So in stage 1 and 2, radiation and surgery. Surgery not in the form of removing the whole voice box, because stage 1 and 2, when small part of the voice box is involved, we need not take out the whole larynx. So stage 1 and 2, either surgery or radiation will give the equal cure. But now, in the vocal cord, each millimeter is important, because vocal cord is the structure which vibrates and produces the sound. Now, each millimeter is important. If I want to take out 2 millimeter versus 3 millimeter, the 3 millimeter will have a little worse voice quality compared to when I want to take out 1 or 2 millimeter, right? So stage 1 and 2, the modality of treatment is either surgery or radiation. That will be decided by your treating doctor, because the location of the tumor in the voice box, it is more on the front side, middle, or back side of your vocal cord, because it is a complex structure. There are so many muscles are also involved. If you want to take out small muscle of the adjacent part, that will also have some implication on your voice. So it has to be judged overall, but largely we can say that stage 1 and 2, it is the surgery. Either you take surgery or you do radiation therapy. The cure rate is almost same. Nothing, no preference is one over other. Stage 3, you can do surgery also, or you might have to add chemotherapy to radiation therapy. Again, you have two preferences, either surgery, but again, little more part of your voice box need to be removed, where half of your larynx, right half, left half, upper half of your larynx, those kind of decision is to be made in surgical, or you might have to add chemotherapy to your radiation therapy. That is a treatment. In stage 4, when your structure, the laryngeal structure framework, which is made up of cartilage, that is invaded, that is when you need to take out the whole larynx. That is the stage 4, and where surgical treatment is preferred, because that gives the better chance of cure.
Doctor, I have a question.
Yes, please.
A polyp on your vocal cords, is that
Yes.
serious?
Polyp is not serious. You can call it as a polyp also. You can call it vocal cord nodule, right? So that occurs sometimes when you call, in medical term, we call the voice abusers. So in a profession where you have to shout, like teachers, politicians, lawyers, or if you're a singer but not singing in a proper way, so that will give you undue stress on your vocal cord, and these small polyps or nodules can arise. But they are benign, they are non-cancerous. Sometimes it can get better with the speech therapy. If it is not getting better with speech therapy, you need to take it out surgically.
Okay. Thank you.
Uh, just welcome to our show today. It's really a pleasure and privilege to have you on our platform. Thank you so very much for your graceful presence. Thank you. Dr. Chancellor, would you mind giving some more idea about the role of speech language therapist?
So, a speech language therapist is a relatively new specialty in India, not like more than 8-10 years. It is very common in US and the western part of the world. So they are the properly trained person who assesses your speech who will advise you about how to speak following this kind of treatment. Suppose you have undergone vocal cord surgery, stage 1 or 2, and some part of your vocal cord is taken out. So, what happens when some part of your vocal cord is taken out? You will feel initially a breathy voice. I will speak like this, right? But then, over a period of time, if we want to improve this, then you need a speech language therapist. It's like a physiotherapist. If your muscle is sore, if your muscle is there is a sprain in your ankle, shoulder, knee, you take help of physiotherapist. They will teach you how to exercise. Speech language pathologists are the one who will teach you or will give you exercises on how to speak so that your voice comes back to normal quicker. There is another thing which also they do is about the swallowing therapy. So they are speech and swallowing therapies usually combined, and they help in rehabilitating the swallowing mechanism after the surgeries of the mouth or throat, and even after the radiation of the vocal cord. So as a clinician, we always feel that because these people need to spend time with the patient. Sometimes we find it difficult to spend the time, and we are not properly trained. Those are the qualified pathologist, qualified person who have learned the detailed mechanism of speech and swallowing, and they spend time with you to take the patients back to their normal speaking and swallowing.
Doctor, what does one do in a city like Delhi with so much pollution that almost all of us have coughs or we have a hoarse throat?
Yes, so I was about to come to this thing about the prevention. How can we prevent the vocal cord cancer? And in that, I'll cover first few things and then come to your question, if you don't mind.
Not at all.
So, how do we prevent the vocal cord cancer? That is one of the most common question amongst the smokers, right? So when a person who is smoking will come to me and say, "How do I prevent? How do I want like this should not the cancer should not happen to me." So this is very simple. You have to stop smoking. There's nothing else you can do other than stop smoking, stop using tobacco in any kind, and even stop alcohol, because alcohol also can cause of the one small part of the voice box cancer. So nothing rocket science about this. You have to stop all those habits to prevent the cancer of the vocal cord. Now, your question, madam, from the cities like Delhi, even in Ahmedabad, where I am, there's a lot of pollution. And obviously, people are concerned about the high level of pollution which they breathe daily. And they says that will this not cause a cancer of vocal cord, even for that matter, lungs also. So answer to that is little difficult, because environmental toxins in terms of toxic fumes in the chemical factories are proved to cause the cancer of the lung and the voice boxes. It is very difficult to prove that this pollution index above this AQI, the air quality index, will cause cancer. This is very difficult to prove in medical science. But overall, there are reports that the high level of vocal cord cancer occurs in urban population rather than in rural population. So this is an indirect way where we can say that the environmental pollution also plays a role. What to do about that is again very difficult answer. You have a mask, yes. So what happens? See, mask became very popular in the COVID time, where everybody knows about the N95, right? So those are the masks which really helps, not the simple handkerchief you put on your face and feel that I am protected against the fumes, but it is the high level proper quality mask, minimum N95. But that is again very difficult to use it daily. We have got rid of it the N95 nobody would like to put back again. But if there are high level of pollution, then it is better to put that mask on to save your vocal cord also and your lungs also.
Nothing else?
Nothing else. I don't see any when the people are using, well, my friends in Delhi, they use the air purifiers in the car, air purifiers at the home. Those are the measures which you can do, of course. But unless we take out the pollution from the environment, there is at a personal level, we can do these things, but we don't have a solid, concrete medical answer for that.
Yeah.
Vijay, please check if there is anyone else to ask question else. I will proceed to ask a few more questions, and also I would like to give some suggestions as well.
Sure, sir. I'll check in a minute.
Sure. So aligning what with what you have said and what just now which you mentioned. Basically avoiding smoking. I mean, apart from pollution, I mean, so at times we cannot control all these stuffs, but at least smoking is kind of a voluntary choice. And let's not forget that while we by ourselves smoking, we are causing a massive environment for the family, for the spouse, and especially for the children that they get exposed to those smokes, and probably they may not get cancer at that point of time, but over a period of time, for a period of time, and so it is essential to it is essential to avoid smoking. I mean, in the best interest of the self as well as in the best interest of the spouse, family, and particularly your children.
Yes, and smoking, I mean to say, let me clarify this. Smoking is not only the active smoking, it is a passive smoking also. We need to get ourselves protected from the person who is smoking. That smoke also, the passive smoking, everybody knows what it is, but that is also equally harmful uh, as compared to the person who smokes. So we should be refraining. That's why the government of India has banned the public smoking also. So we should not shy away in telling someone if somebody is smoking in public. We should not shy away in telling them to stop smoking.
And now on this point, let me add one thing here that by any chance, if we are getting diagnosed with the cancer, no cigarette company, no tobacco companies, etc., is going to support you that okay, take this money for your treatment. So I mean, you are inviting trouble simply by spending money for smoking or using tobacco in a various form. So I mean, we are using smartphone, but we are not becoming smart enough to stop smoking or consuming tobacco in a different format. So that is rather a big awareness is to be done.
Yes, and that brings to like one of the very common question which our patients, other the friends also ask, that how do I screen myself uh, for this type of cancer? How do I don't have any problem right now, but I'm smoking. Then what should I do to make sure that I don't have anything? So for the screening method, it is best to visit the doctor, because see, your cancerous growth inside the mouth or the tongue or jaw will be visible from outside. When you open the mouth and everything, you can see. To see the voice box, you need a special instrument. that is available to a qualified other doctors, most commonly ENT doctors. So if you feel that if you are smoking and you want to get yourself screened, it is better to visit at least a ENT surgeon to have a look at your voice box every 6 months to 12 months as comfortable you are. But this is the only thing which you can do to detect early and get treated early.
Right, absolutely right, sir. I'm still bit more skeptical about choosing the radiotherapy as against surgical procedure for vocal cord cancer diagnosis. If you are competent in a cancer surgeon, you've done so many surgeries, particularly pertaining to CNNs for vocal cord. So, what would be your first preference when a vocal cord cancer patient approaches you, whether you will recommend uh, radiotherapy or straightway surgery?
So here we have to understand one thing, that surgery for the early vocal cord cancer doesn't mean removal of the voice box. Here, what surgery means, that in your vocal cord, suppose this is the vocal cord, if here is a small lesion of cancer, I can easily have a laser cut like this and remove the disease in, like, say, 1 hour of surgery, and it is done. You are cured. But choice between surgical treatment versus radiotherapy in early voice box cancer, there are many other factors also which comes into play. So it is not always like I have a stage 1 or stage 2 vocal cord cancer, I will go for surgery. It is not a dictum. Both treatment have equal cure rate. Both treatment preserves your normal voice also, right? But which treatment is to be taken, that depends on the patient factor, that what are their preferences, how, because for radiation you will have to stay in the city where radiation facility is available for 1.5 months. They have to come back for follow-up in either of the cases. For surgeon to reach to this area is also a challenge, because sometimes in difficult voice boxes we may not be able to see it through the scope, right? So there are many factors which involves while treatment is considered surgically, right? And with the discussion of a patient, both can be chosen. So no prejudice against any of the treatment. Both are good. Both will cure the cancer. Both will preserve the voices. It is just about what are the preferences of the patient also, and each patient is different. So no clear cut answer for what will I prefer. It is with the discussion of the patient, what are their expectation as well. For stage 4 cancer, it is clear that the voice box has to come out to cure the cancer.
Right, sir. And sir, again, continuing with the same question. If someone is given radiotherapy and then, if recurrent cancer is taking place of the, vocal cord, then, do you have to give radiotherapy once again, or you will have to opt for the straight surgery?
So once radiotherapy is given and the cancer comes back, usually the next choice of treatment is surgical only. And which surgical treatment, which I said, with the help of laser, I can remove the small portion of the cancerous part. That all depends on the stage of the new cancer or the recurrent cancer, how big it is, where it is, whether it has eroded the laryngeal framework, it has distorted the laryngeal framework. All those questions needs to be look at it, and then decide the treatment in the form of the next surgical so once radiation is given, no more radiation, that is for sure. But surgical treatment, the laser surgery or the removal of the larynx or partial laryngectomies also, what kind of surgery is to be done, that depends a lot on the stage of the cancer at that time. But as you said, once radiation is taken, no more radiation for the second time for if the cancer is recurring.
Right, right. Thank you very much, sir. And Vishani, if there is no questions, we can wrap up the today's session, and we'll add to some additional information.
Sir, there is no more question in the text box or on the Facebook.
All right. So, friends, you know, to our show, which is webinar, live webinar, where we are bringing the top of the line cancer specialist simply for their knowledge sharing despite their heavy engagement and commitments of surgery and so many things. So one of the prime focus on our show, that is Friday's with Shrenik, is very simple. Like, there are a lot of informations and details are available on web browsers, and typically we are conducting such kind of live webinar and inviting super specialists for knowledge sharing simply because if you are not qualified medical professional, don't follow or don't become a doctor if you are not qualified, and better opt for consultation with the doctors whoever you feel appropriate, because your life is precious, and better not to play shot in dark. So this is all from my side, and Dr. Daxesh Patel, thank you so very much for coming on our show, and I'm having incredible privilege that you have started the ball rolling. You have started the ball rolling on behalf of myself, and especially on behalf of Indian Cancer Society to support large number of cancer community all over the world. So thank you so very much, and I express my deepest gratitude on behalf of Indian Cancer Society, Delhi branch, on behalf of Joseph Kavalji, on behalf of Priya Parmar, and of course on behalf of myself as a patient ambassador and a moderator of Indian Cancer Society, Delhi. Thank you very much, and thank you all attendees for joining us today. Thank you.
Thank you,
Thank
thank
you.
you,
Thank you, doctor.
thank you very much.